Welcome to the deep dive. Today we're diving into one of the most fundamental parts of nursing, vital signs.
Yeah, going way beyond just how to even take them.
Right.
We're going to look at what those numbers tell us, about a patient's health and how these simple measurements can actually be a real lifesaver in the clinical setting.
Exactly. Like vital signs are this secret language that once you learn it,
Oh, yeah.
it gives you this incredible insight into what's happening in the body.
Absolutely.
So for, all you nurses out there starting your journey, get ready to unlock some serious superpowers.
That's right.
I remember back, when I was starting out, I was always told that vital signs were super important, but I never really understood the why.
Sure.
Could you kind of shed some light on that for us?
Yeah, absolutely.
Yeah.
So vital signs are crucial because they really provide that snapshot of how well, the body's major systems are functioning.
Okay.
So think of it as a baseline. Any deviation from that baseline could be like an early warning sign of a problem.
So it's like a built-in alarm system?
Yeah.
Letting you know, hey, something's off even before the patient starts showing symptoms.
Exactly. And the beauty of vital signs is that they can be assessed so quickly and easily
Right.
in any healthcare setting.
Yeah.
That's why we check them so often.
Oh, okay, that makes sense.
Yeah.
So when we talk about checking vital signs,
Yeah.
is it like a one-time thing when a patient's admitted to the hospital?
No, not at all.
Okay.
We assess vital signs on admission, of course,
Right.
but it's much more dynamic than that.
Okay.
We check them anytime a patient's condition could change.
Mm-hmm.
Before and after procedures, before and after certain medications,
Okay.
even after just simple activities, like walking.
Wow. I had no idea.
Yeah.
I always kind of thought of them as static,
Right.
but it sounds like they're constantly evolving
Yeah.
based on what's happening.
Precisely. It's being proactive and monitoring those subtle shifts that could, indicate a problem. Right.
Wait, and the frequency really depends on the individual patient.
Okay.
So, for example, someone in the ICU might need continuous monitoring,
Right.
while someone recovering at home after a minor procedure might just need their vitals checked, a few times a day.
Okay, so it's all about tailoring it to the individual patient.
Exactly.
Okay, let's dive into the first vital sign, temperature.
Okay.
Now, I remember learning that 98.6 degrees Fahrenheit is the normal temperature.
Yeah.
But is that really the magic number for everyone?
Yeah, it's a great starting point.
No.
But the truth is, it's a little more nuanced than that.
Okay.
You see, 98.6 degrees Fahrenheit is just an average.
Okay.
Each person has their own normal range, and that can be influenced by things like age, time of day, even activity level.
So someone might run a little warmer or a little cooler
Right.
than average and still be perfectly healthy.
Exactly.
Okay.
Yeah.
It's fascinating that our body has this internal thermostat.
Yes.
The hypothalamus working to keep our temperature balanced. Exactly. The hypothalamus is constantly receiving information from temperature sensors throughout the body and making adjustments to keep everything in check.
And speaking of temperature fluctuations, I've noticed that my own temperature seems to change throughout the day.
Uh-huh.
Should I be worried about that?
Not necessarily.
Okay.
Our bodies go through these natural temperature cycles throughout the day, usually lower in the morning and slightly higher in the evening.
Oh, okay.
It's called our circadian rhythm.
Oh, that makes sense.
Yeah.
That's a relief.
Good.
Our bodies are way more complex than we realize,
They are.
with all these systems working together to keep us functioning.
That's right.
Now let's talk about fevers.
Okay.
You might think of a fever as a bad thing,
Mm-hmm.
but it can actually be a sign that your body's fighting off an infection.
Right.
So it's like the body's natural defense mechanism.
Exactly.
It's like, hey, we're going to turn up the heat,
Yeah.
make it uncomfortable for these invading bugs.
Yeah. Exactly. A moderate fever can actually be beneficial in helping the immune system do its job.
Okay.
However, a high fever, usually above 104 degrees Fahrenheit, can be dangerous and requires, prompt attention.
Okay, so it's a balancing act.
Yes.
A fever can be helpful,
Yeah.
but it's crucial to know when it crosses the line
Yes, definitely.
and becomes a cause for concern.
Right.
Now, on the other end of the spectrum, we have hypothermia,
Right.
when the body's temperature drops too low.
Yes.
I remember once when I was skiing and the weather turned really nasty.
Uh-huh.
I got so cold that my teeth started chattering uncontrollably.
Oh, wow.
Turns out I was experiencing mild hypothermia.
Yeah.
Luckily, I was able to get inside and warm up pretty quickly.
Yeah, good.
Yeah,
That's a
but-
great example.
Yeah.
Shivering is one of the early signs of hypothermia.
Okay.
And it's the body's way of trying to generate heat by rapidly contracting the muscles.
Oh, so it's like the body's trying to warm itself up?
Exactly.
Okay, so whether it's a fever or hypothermia, it's clear that extreme temperatures can signal that something's wrong.
Absolutely.
Now, when it comes to actually measuring temperature, there are several different methods we use,
Yes.
each with its own pros and cons.
That's right.
I remember learning about oral, rectal, axillary, and tympanic temperature measurements.
Mm-hmm.
Is there one method that's considered like the gold standard?
You know, the best method really depends on the patient's age, their condition, and the situation.
Okay.
So, for example, we wouldn't take an oral temperature on someone who is unconscious
Right.
or having difficulty breathing.
Right, that makes perfect sense.
Yeah.
It's all about choosing the safest and most appropriate method
Exactly.
for each individual patient.
Yep. And no matter which method you use, it's crucial to use proper technique and follow the manufacturer's instructions to ensure accurate readings.
Okay, we've tackled temperature, which is clearly more than just a number on a thermometer.
It is.
Now let's move on to the next vital sign.
Okay.
Pulse. When we feel someone's pulse,
Mm.
what information are we actually getting?
So the pulse is a direct reflection of the heart's pumping action.
Oh.
Each time the heart beats, it sends a surge of blood through the arteries,
Hmm.
creating this pressure wave that we can feel as a pulse.
So it's like we're feeling the heartbeat in these peripheral vessels.
Exactly.
But there's more to assessing a pulse than just feeling for it, right?
Right.
I remember learning about rate, rhythm, and strength.
You're absolutely right.
Okay.
Assessing a pulse involves paying attention to those key characteristics.
Okay.
So the rate tells us how many times the heart beats per minute.
Mm-hmm.
The rhythm tells us if the beats are regular or irregular.
Right.
And the strength gives us an indication of, how strong that heartbeat is.
So it's like gathering clues about the heart's function with each pulse check.
Exactly.
Now, we all know that exercise can increase our heart rate.
Yes.
What are some other factors that can affect the pulse?
Lots of things. Age, for example. As we get older, our resting heart rate tends to slow down.
Mm-hmm.
Women typically have slightly higher heart rates than men.
Interesting.
And I've also noticed that my heart rate goes up when I'm stressed.
Me too. Does that play a role?
Absolutely. Emotions like stress and anxiety can trigger the release of adrenaline,
Oh, okay.
which causes the heart to beat faster.
Okay.
And certain medications like those used to treat asthma or high blood pressure can also influence heart rate.
It sounds like a complex interplay of factors.
It is.
So when we assess the pulse, we need to consider all these things.
Yes.
To get like a clear picture
Exactly.
of what's going on.
That's right.
Now, there are two terms you'll often hear when we're discussing pulse, tachycardia and bradycardia.
Yes.
So tachycardia is a fast heart rate,
That's right.
and bradycardia is a slow heart rate.
Correct.
But when should we be concerned about these variations?
Well, both tachycardia and bradycardia can be normal in certain situations.
Okay.
For example, tachycardia is expected during exercise or when someone is anxious.
Okay.
And bradycardia can be normal in well-trained athletes.
Oh, interesting.
So it's all about context.
Okay.
A heart rate of 120 might be perfectly fine for someone running a marathon,
Right.
but it could be a red flag in someone who's just, resting.
Yeah, that makes sense.
So we need to consider the patient's overall condition, any symptoms they're experiencing, and their medical history when we're evaluating their pulse.
Okay, we've explored temperature and pulse, two vital signs that are clearly more than just numbers.
They are.
Now, what about respirations?
Okay.
What are we really assessing when we look at a patient's breathing?
So when we assess respirations, we're really evaluating the effectiveness of the body's gas exchange,
Okay.
taking in oxygen and getting rid of carbon dioxide.
Right.
We're looking at the rate, the depth of each breath, and the rhythm of that breathing pattern.
So it's not just about counting breaths.
Yeah.
We're looking at how well the respiratory system is functioning.
As a whole, exactly.
Yeah, as a whole. Okay, and just like with pulse, there's a normal range
Yes.
for respiratory rate,
Uh-huh.
which can vary depending on age.
Right.
But for adults, it's typically between 12 and 20 breaths per minute.
That's right.
Okay, so 12 to 20 is kind of our ballpark.
Yeah.
But what can cause someone's breathing to speed up or slow down?
Well, just like with pulse, a variety of factors can influence respirations.
Okay.
Exercise, of course, increases the demand for oxygen.
Right.
So breathing rate and depth naturally increase.
Right.
But things like pain, anxiety, and certain medications can also affect breathing.
This makes me think about how all these vital signs are connected. The body is such an intricate system.
It is absolutely. The body systems work together in harmony.
Right.
And vital signs give us that glimpse into that interconnectedness.
Yeah.
By carefully assessing each vital sign and looking for patterns, we can gain a deeper understanding of our patient's overall health.
That's fascinating. I'm starting to feel like a real detective, piecing together clues to unravel the mysteries of the body.
I like that.
Okay, we've covered temperature, pulse, and respirations.
Yeah.
What's the final vital sign we need to address?
Let's talk about blood pressure,
Okay,
which is the force of blood against the walls of the arteries.
right, blood pressure.
It's a vital indicator of cardiovascular health.
I've heard it mentioned so many times,
Yeah.
but I'm still a little fuzzy on what those numbers actually represent.
Okay, so think of it this way. Every time your heart beats,
Mm-hmm.
it pumps blood out into the arteries.
Right.
That creates pressure against the artery walls,
Okay.
which is what we measure as blood pressure.
So it's like the force of that heartbeat pushing against the vessels.
Exactly.
Yeah.
Now, when we measure blood pressure, we actually get two numbers,
Right.
the systolic pressure and the diastolic pressure.
I've heard those terms before.
Yeah.
Could you remind us what they mean?
Yeah, so the systolic pressure, the higher number is the pressure when the heart contracts and pumps blood out. The diastolic pressure, the lower number, is the pressure when the heart relaxes between beats.
So it's like the peak pressure and the
Right.
resting pressure
Yes.
within the arteries.
Exactly. And those numbers are important because they tell us how hard the heart is working.
Okay.
And how much stress is being put on those blood vessels.
So what is considered a healthy blood pressure reading?
Okay.
And how do we accurately measure it?
So blood pressure is measured in millimeters of mercury,
Wow.
MHg.
Okay.
And a healthy reading for most adults is typically less than 120 over 80
Okay, 120 over 80.
MHg.
Okay.
And to measure blood pressure, we use a device called a sphygmomanometer,
Okay.
which consists of an inflatable cuff and a gauge.
Right.
Yeah.
So 120 over 80 is the target we're aiming for.
Exactly.
But what happens when blood pressure is too high or too low?
Okay.
We often hear about hypertension
Yes.
and hypotension.
Right.
What are those and why are they dangerous?
So hypertension is high blood pressure, and it's one of the most common health problems worldwide.
Wow.
It's often called a silent killer.
Yeah.
Because it may not cause noticeable symptoms in the early stages.
Oh, wow.
Yet it can lead to very serious complications like heart attack, stroke, and kidney disease.
My grandmother was diagnosed with hypertension a few years ago,
Okay.
and she had to make some significant lifestyle changes
Yeah.
and even start taking medication to manage it.
That's not uncommon.
Yeah.
Lifestyle modifications such as weight loss, a healthy diet, regular exercise,
Right.
and stress management can help lower blood pressure.
Okay.
But for many people, medication is also necessary to get that blood pressure under control.
So high blood pressure is all about excessive force on those blood vessels.
Exactly.
But what about low blood pressure?
Yeah.
Is that ever a cause for concern?
So hypotension or low blood pressure can also be a problem, especially if it causes symptoms like dizziness, weakness, or fainting.
Okay.
It can be a sign of dehydration, blood loss, or certain medical conditions.
It seems like finding that sweet spot for blood pressure is crucial
Yes, it is.
for maintaining good health.
It is.
And just like with the other vital signs, accurate measurement is key.
Absolutely. Proper technique, using the right size cuff, positioning the patient correctly, are all essential for
Yeah.
getting reliable blood pressure readings.
Okay, so we've covered all four main vital signs:
We have.
temperature, pulse, respirations, and blood pressure.
Yes.
What I'm really starting to understand is that it's not just about taking the numbers.
Right.
It's about seeing the bigger picture
Uh-huh.
and understanding how all these vital signs work together to tell us about a patient's overall health.
You're absolutely right. Vital signs are like puzzle pieces
Yeah.
that, when assembled, correctly reveal a comprehensive picture of the patient's physiological state.
We've certainly covered a lot of ground in this deep dive into vital signs.
We have.
But before we wrap up this part of our conversation, I have one final question.
Okay.
Is it ever possible for vital signs to be misleading?
Ooh, it's a good one.
Could they mask underlying problems?
That's an excellent question.
Yeah.
And one that every nurse should consider.
Right.
While vital signs are incredibly valuable, they're not foolproof.
Okay.
There are instances where a patient's vital signs might appear normal,
Right.
even when there's a serious underlying issue.
So it's crucial to remember that vital signs are just one piece of the puzzle,
Exactly.
not the whole picture.
We need to combine our assessment of vital signs with other clinical data, patient history, and our own critical thinking skills
Right.
to make informed decisions about patient care. You know, it's like We're detectives gathering clues,
Yeah.
putting them together to solve a case.
Right.
And just like a good detective, we need to be thorough, in our assessment, looking for those subtle patterns, considering all the angles.
This makes me think about something we haven't really touched on yet.
Okay.
We've talked a lot about how to assess vital signs accurately, but what about the patient's understanding of their own vital signs?
Yeah.
It seems like empowering patients with that knowledge could be a really powerful tool
Absolutely.
for promoting health and self-care.
You've hit on a really crucial aspect of nursing.
Yeah.
We have a responsibility to promote health literacy.
Right.
Which means explaining things in a way that patients can understand.
Right.
And giving them the tools that they need to be active participants in their own care.
So it's about moving away from that paternalistic model of healthcare.
Yeah.
Where, the doctor or the nurse is telling the patient what to do.
Right.
And instead fostering a more collaborative approach.
Exactly.
Yeah.
When patients understand their vital signs, they're more likely to recognize when something isn't right.
Right.
And to seek help sooner.
Yeah.
They can also use that knowledge to make informed decisions about their lifestyle, and their health habits.
It's about empowering patients to take ownership of their health.
Absolutely.
Yeah.
And it can lead to better outcomes for everyone involved. Patients who are actively engaged in their care tend to be more adherent to treatment plans and have a better overall health status.
That makes perfect sense. It's about building that partnership between the healthcare provider and the patient.
Yes.
Working together toward a common goals of optimal health.
Precisely so. As you continue your deep dive into the world of nursing, remember that vital signs are much more than just numbers.
Right.
They're a vital window into a patient's well-being and a powerful tool for promoting health literacy and patient engagement.
This has been an incredible journey so far.
It has.
I feel like I've gained this whole new appreciation of the complexity and importance of vital signs in nursing practice.
Absolutely.
But before we wrap up our deep dive, I have one more kind of burning question.
Okay.
We've talked about how vital signs can be these early warning signs of problems.
Right.
But is it ever possible for vital signs to be misleading?
That's a brilliant question. And one that highlights the importance of critical thinking in nursing.
Yeah.
While vital signs are incredibly valuable, they're not foolproof.
Right.
There might be times when a patient's vital signs appear normal on the surface.
Right.
But something more serious is going on beneath the surface.
So we can't just rely on the numbers alone.
No.
We have to consider the whole patient, their individual circumstances, and any other clinical data we have.
Exactly. Vital signs are a crucial piece of the puzzle.
Right.
But they're just one piece.
Right.
We need to use our knowledge, our skills, and our clinical judgment to interpret those vital signs in the context of the patient's overall presentation.
It's like being a detective,
Uh-huh.
but with even higher stakes.
Yeah.
We're not just solving a case. We're potentially saving a life.
You got it. And that's what makes nursing such a challenging and rewarding profession.
Right.
We have the opportunity to make a real difference in people's lives, and vital signs are one of the most powerful tools we have.
Yeah. This deep dive has been eye-opening. I feel like I've gained a whole new level of understanding of vital signs and their significance in nursing practice.
And remember, this is just the beginning of your exploration.
Yeah.
There's always more to learn, more to discover, and more ways to refine your skills as you continue your nursing journey.
Speaking of further exploration, I'm curious about some specific examples
of
how vital signs might be misleading.
Sure.
Could you walk us through a few scenarios where the numbers might not tell the whole story?
Absolutely. So let's imagine a scenario where you're caring for a patient who's been admitted with severe abdominal pain.
Okay.
Their vital signs at first glance seem relatively stable.
Okay.
Their temperature is normal, their pulse is slightly elevated, and their respirations are within the normal range. However, you notice that their blood pressure is trending downwards.
Ooh, that sounds like a potential red flag.
It certainly is.
Yeah.
While their other vital signs might seem reassuring, that dropping blood pressure could be a sign of internal bleeding or a worsening infection.
So even though their temperature and respirations are normal, we can't ignore that subtle shift in blood pressure.
Exactly. It's crucial to recognize that vital signs don't exist in isolation.
Right.
They're interconnected and they must be interpreted together.
Okay.
Considering the patient's overall presentation and the clinical context.
That makes perfect sense. Are there any other examples where vital signs might be deceiving?
Let's consider another scenario. Imagine you're caring for an older adult patient who has a history of heart failure.
Okay.
They're admitted to the hospital with shortness of breath and fatigue. Their vital signs show a slightly elevated heart rate, normal respirations, and slightly elevated blood pressure.
So nothing seems too alarming at first glance.
Right, but you notice that their oxygen saturation is below normal, despite their seemingly normal respiratory rate.
Okay.
This could be a sign of silent hypoxia, a condition where oxygen levels in the blood drop dangerously low without any obvious changes in breathing.
Wow, that's scary. So even though their respirations seem normal, there could be a serious underlying problem.
Precisely. This is why we can't rely on any single vital sign in isolation.
Right.
We have to look at the whole picture, gather information from multiple sources, and use our critical thinking skills to identify potential red flags.
These scenarios are really eye-opening.
They are.
They highlight the importance of being vigilant and not just accepting vital signs at face value.
Exactly. We have to be like detectives.
Right.
Looking for those subtle clues that might point to a larger problem.
This deep dive is really making me think about how vital signs are just the starting point.
Yes, they are.
For our assessment.
Vital signs provide a snapshot of the patient's current state.
Right.
But they're not the whole story.
We need to combine our assessment of vital signs with other clinical data, our knowledge of the patient's medical history, and our own critical thinking skills to make informed decisions about their care.
Precisely, it's about being holistic in our approach, considering the whole patient.
Right. Never losing sight of the human being behind the numbers.
This has been an incredibly insightful deep dive.
It has.
I feel like I've gained a much deeper understanding of vital signs and their significance in nursing practice.
And remember, this is just the beginning of your journey.
Right.
There's always more to learn, more to discover, and more ways to refine your skills as you continue exploring the fascinating world of nursing.
It's amazing to think that these seemingly simple measurements can tell us so much about a patient's health and well-being. But as we've learned today, it's not just about taking the numbers. It's about understanding what those numbers mean, recognizing patterns, and using our clinical judgment to make informed decisions.
Absolutely. Vital signs are a powerful tool in our nursing arsenal.
Yes.
But they're just one piece of the puzzle.
We need to use all our senses, our knowledge, and our critical thinking skills to provide the best possible care for our patients.
Yeah, like we're piecing together this complex puzzle, using every bit of information we have to create a picture of the patient's health.
You've captured the essence of nursing perfectly. It's about being a detective, an advocate, and a compassionate caregiver.
Right.
All rolled into one.
I feel like this deep dive has not only expanded my knowledge of vital signs, but it's also deepened my understanding of the core principles of nursing practice.
And that's the beauty of lifelong learning in nursing.
Yeah.
There's always something new to discover, a new challenge to embrace, and a new way to refine our skills.
This conversation has been so valuable.
Yes.
And I'm sure our listeners are walking away with a renewed appreciation for the power of vital signs.
I hope so. Remember, vital signs are more than just numbers on a chart.
Right.
They're a vital language that, once understood, can unlock so much information about a patient's well-being. So to our listeners out there, I encourage you to keep asking questions, keep learning, and keep diving deep into this fascinating world of nursing.
Yeah, never underestimate the power of observation, critical thinking, and a genuine desire to understand, the intricate workings of the human body. And never forget that behind every set of vital signs is a human being.
That's right.
Who deserves our compassionate and skilled care.
Beautifully said.
Yeah.
Keep that human connection at the heart of your practice, and you'll be well on your way to becoming an exceptional nurse.
Thank you so much for joining us on this deep dive into vital signs.
It was my pleasure.
We'll be back soon with another insightful episode exploring a new facet of the nursing profession.
Okay.
Until then, stay curious and keep learning.